Hi guys, in this video we're going to be going over our acute shoulder phase 1 stretches. So we've hurt our shoulder either to repetitive stress or a acute trauma, and so it's real inflamed and spasmed up. So what we want to do is stretch those muscles out and help get range of motion back into that joint. So first of all we want to work on is opening up and stretching out our supraspinatus tendon. We'll take our handy dandy shoulder here. And so our shoulder sits here like this, and what we have is our supraspinatus tendon actually attaches along back here on the superior border of our spine, our scapula, comes down and around over this joint and actually attaches down here on onto our humerus. So what we want to do with that, or what that tendon or muscle does, is it actually pulls your humeral head down and in and creates a little gap here between these two, your acromion and your humeral head, to help or create range of motion in that joint. But a lot of times it can get, if your shoulder's chronically rolled forward, or if you have an injury to it, or a lot of repetitive stress, that tendon actually gets pinched in that, between those two bones. It's called what we call shoulder impingement syndrome. And so what happens is it continues to fray and defray and defray, and if we let it go on and on and on and never do anything about it, or ignore the pain and get corticosteroid injections in it, and we continue to do those activities, because we won't fear our pain, you can actually start to develop what they call a little acromion bone spur. And that's the body's reaction to that chronic stress on there. It doesn't like that stress or instability, so the body's going to lay down bone, or it's going to lay down scar tissue. In this region here, it lays down bone, and we get a bone spur. And so we want to prevent stuff like that, because you don't want to have to go in here and have it shaved off. So we can easily show you some stretches like we're going to do today to help do that. So we're going to, first of all, let's do our sleeper stretch. So we come straight up to the wall, straight across. We bring our arm up to just about 90, just below that, we'll say about 80. And then we're going to bend our elbow 90 degrees. And with our opposite hand, we're going to gently push down here. And what this is called the loose pack position. It isolates that supraspinatus tendon that we just talked about, and it helps to open that up and stretch it out. So the research doesn't show that 10 seconds hold, 20-second hold, 30-second, or even a minute hold are any better than the other ones. So I always tell patients, hold this for as long as you feel a good stretch, and then we're going to gently relax. Because you don't want to jam it down, because we don't want to tear it anymore, and we don't want to let go too fast and it goes and spasms up again. So we want to slowly and steadily do our stretch. The next one we want to do too is to open up that joint and to help decompress that area and get some range of motion into that joint. And so with that, what we're going to do is called our Codman's pendulum swing. We're going to use the natural weight of our arm and hold it down here, act like it's dead, and we're going to use our body to swing that left and right. We swing it up and down. Use our body weight to swing it in that external rotation and then into an internal rotation. So we're opening up that joint, using our natural weight of our arm, open that up, distract it, and get range of motion. So not everybody's got a lot of meat like this, and so we can use a little bit of a weight. 1 pound weight or 16-ounce can of soup. So, and when you grab that weight, don't grab that weight like you're trying to own the thing. So what we want to do is, because you can actually contract those muscles and make it worse. So we just want to use the hand, our hand muscles, gently grab that weight, allow it to pull down, decompress that weight, or that joint, and then just let it hang there and do just what it does. Let it swing and get range of motion into that joint while distracting it or decompressing. Nice, simple, pain-free. If you notice pain with this activity, that means you're using your arm muscles to move, and we don't want to do that. We want to use just momentum to swing that around. And then the third one we're going to go over is called our spider climb. We want to get that range of motion in there so it doesn't freeze up. We don't want to get a frozen shoulder, adhesive capsulitis. The kind of thing, so we're going to do is called a spider climb. So we come over to our wall here. You can even do it near a door frame, it's better sometimes. And so we go ahead and grip our wall here, because you can use this door frame over here, because we want to put pressure into our palm here to activate the muscles to keep it from hurting. And so we push our palm into the wall, or you grip over here and you grab it and you pull yourself into the wall. And then you get up as high as you can, and then you use your fingers to slide that palm up, making sure you're pushing into the wall. And we get up as high as we can, and then we push our palm into the wall, and we slide down, and we start over again. Do that about 3 or 4 times. When we get up, we try to get up as high as we can get up, because we might not be able to get our full range that we need at 180. So we get up as high as we can. Every time we do it, we try to get just a little bit higher if we can. Push that palm into the wall, come down, and to prevent that muscle from contracting, at the end here, we grab our wrist and we pull that off to keep our arm from activating those muscles and causing that spasm again. Thank you for joining us for this video.